Hi, I'm Dr. Chris Lewis, one of the chief educators here at Doctors in Training, and I want to welcome you to another Solid Anatomy lecture. So in this lecture, we'll be discussing the contents of the infratemporal fossa and the pterygopalatine fossa. Now, I'll be back later for some clinical correlations in the end of session quiz, but for now, I'm going to turn it over to our primary lecturer, Dr. John Phelan.
Let's resume our discussion of the contents of the infratemporal fossa. The nerves residing in the fossa are the mandibular division of the trigeminal nerve, the chorda tympani, and the nerves associated with the otic ganglion. The mandibular division is the only division of the trigeminal nerve that carries motor neurons in addition to sensory neurons. As is the case with the ophthalmic and maxillary divisions, the sensory neurons of the mandibular division of the trigeminal nerve are mostly pseudo-unipolar neurons whose cell bodies reside in the trigeminal ganglion in the middle cranial fossa. The only exceptions are proprioceptive neurons involved in mastication whose cell bodies are in the brainstem. The trigeminal ganglion is found between the meningeal and periosteal layers of the dura mater in an extension of the subarachnoid space called Meckel's cave. Peripheral processes of sensory neurons in the ophthalmic, maxillary, and mandibular divisions enter the middle cranial fossa via the superior orbital fissure, foramen rotundum, and foramen ovale, respectively, and converge on the trigeminal ganglion. The central processes of the sensory neurons of all three divisions combine with the peripheral processes of the proprioceptive neurons to form the sensory root of the trigeminal nerve, which extends posteromedially from the trigeminal ganglion, emerges from the dura mater, and enters the brainstem at the ventral surface of the pons. The cell bodies of the proprioceptive neurons are collected in the mesencephalic nucleus of the trigeminal nerve, which extends into the midbrain from the rostral part of the pons. This marks the only exception in the entire human body to the rule stating that the cell bodies of afferent or sensory neurons are found in ganglia in the peripheral nervous system, not in nuclei in the central nervous system. These proprioceptive neurons are pseudo-unipolar neurons whose peripheral processes run largely in the sensory root of the trigeminal and whose central processes run in tracts in the central nervous system to synapse in a variety of nuclei, including the motor nucleus of the trigeminal. The central processes of neurons conveying general sensation synapse at the principal sensory nucleus of the trigeminal nerve in the pons, while the central processes of neurons conveying pain and temperature synapse at the spinal nucleus of the trigeminal nerve, which extends from the pons caudally into the medulla and upper cervical spinal cord. The motor nucleus of the trigeminal nerve, which is found in the pons just ventral and medial to the principal sensory nucleus, is the home of the cell bodies of the motor neurons of the mandibular division. These neurons are lower motor neurons. The upper motor neurons run caudally from the cerebral cortex to synapse in the motor nucleus. The main sensory branches of the mandibular division of the trigeminal nerve may be remembered by the mnemonic Malibu. M is for the meningeal branch, which may pass through the foramen spinosum or the foramen ovale to enter the cranial cavity, where it provides sensation to the dura mater along with the meningeal branches of the other divisions of the trigeminal nerve. A is for the auriculotemporal nerve, which usually splits into a pair of roots, or rami, shortly after branching from the mandibular division. These rami encircle the middle meningeal artery, which will be described shortly, then merge to form a single nerve again that travels posteriorly towards the temporomandibular joint to which it provides sensation. It leaves the infratemporal fossa and enters the retromandibular fossa, passing through the substance of the parotid gland. The auriculotemporal nerve leaves that fossa and ascends with the superficial temporal artery anterior to the auricle, providing sensation to part of the external ear and the skin anterior to it. L is for the lingual nerve, which descends along the medial side of the lateral pterygoid, where it is joined by the chorda tympani nerve. If you've watched the Solid Anatomy lecture on the ear, you may recall that the chorda tympani nerve is a branch of the facial nerve that passes through the middle ear and enters the infratemporal fossa by passing through the petrotympanic fissure in the temporal bone. The combined chorda tympani and lingual nerve turns laterally to pass between the lateral and medial pterygoids and continues inferiorly and anteriorly between the lateral surface of the medial pterygoid muscle and the ramus of the mandible. It leaves the infratemporal fossa and enters the oral cavity by passing inferior to the vicinity of the pterygomandibular raphe, where the superior pharyngeal constrictor and buccinator fuse to each other. The chorda tympani carries preganglionic parasympathetic fibers that innervate the submandibular and sublingual glands, and special sensory fibers that convey taste from the anterior two-thirds of the tongue, while the lingual nerve conveys general sensation from the same part of the tongue. To hear more details about the innervation of the tongue, download the Solid Anatomy lecture on the oral cavity and oropharynx. And now back to Malibu. So L was lingual. I is for the inferior alveolar nerve, which contains sensory and motor fibers. It runs parallel and posterior to the lingual nerve and also emerges between the two pterygoid muscles. It continues inferiorly between the medial pterygoid and the ramus of the mandible until it reaches the mandibular foramen. At this point, all of the motor fibers branch off to form the mylohyoid nerve, or nerve to the mylohyoid. This nerve descends until it crosses the inferior border of the mandible to enter the floor of the submandibular triangle, which you may recall from the Solid Anatomy lecture on the anterior triangle of the neck. Not surprisingly, the mylohyoid nerve innervates the mylohyoid muscle, which forms the floor of the submandibular triangle, then dives under the anterior belly of the digastric muscle, which it also innervates. The inferior alveolar nerve, which is now entirely sensory, enters the mandibular foramen and passes through the mandibular canal to reach the alveolar process of the body of the mandible, where it provides sensation to the mandibular teeth. Why is the nerve given the name alveolar? Alveolus is a Latin word meaning a small hollow or sac-like area, which describes the shape of the tooth socket. A branch of the inferior alveolar nerve, the mental nerve, exits the mandible through the mental foramen, which is most often found at the level of the second molar tooth. The mental nerve is sensory to the skin over the anterior part of the body of the mandible and the lower lip, as well as the anterior gingivae, or gums. And finally, BU, which stands for the buccal nerve, sometimes referred to as the long buccal nerve, which travels antero-inferiorly and usually passes between the superior and inferior heads of the lateral pterygoid muscle. It descends to the level of the buccinator muscle, gives off a branch that innervates skin over the buccinator, then pierces the muscle to innervate oral mucosa on the medial side of the buccinator. The buccal nerve does not provide motor innervation to the buccinator. It is a muscle of facial expression, so it receives its motor innervation from the facial nerve. The mandibular division of the trigeminal nerve provides motor innervation to 8 skeletal muscles in the head, We've already noted that the mylohyoid muscle and the anterior belly of the digastric receive motor innervation from the mylohyoid nerve, which branches from the inferior alveolar nerve. The otic ganglion, the parasympathetic ganglion of the glossopharyngeal nerve, is connected to the mandibular division of the trigeminal by a couple of nerves that usually include the nerve to the tensor tympani and the nerve to the tensor veli palatini. Both of these motor branches of the mandibular division of the trigeminal pass through the otic ganglion without synapsing and continue to their target muscles. The tensor tympani, which acts on the ossicles of the middle ear to dampen loud sounds, is discussed in the Solid Anatomy lecture on the ear, while the tensor veli palatini muscle, which opens the pharyngotympanic tube and has an association with the palate, is discussed in the Solid Anatomy lectures on the ear and on the nasal cavity and nasopharynx. Also branching from the mandibular division in the infratemporal fossa are motor nerves to the four muscles of mastication. A masseteric nerve leaves the fossa by passing through the mandibular notch to reach the masseter. A pair of deep temporal nerves leaves the infratemporal fossa and enters the temporal fossa by crossing the medial surface of the zygomatic arch. They innervate the temporalis muscle. Nerves to the medial and lateral pterygoids do not have to leave the fossa to reach their target muscles. And now a final word about nerves of the infratemporal fossa. You may recall from the Solid Anatomy lecture on the ear that parasympathetic neurons originating in the inferior salivatory nucleus travel in the glossopharyngeal nerve and branch off from its inferior ganglion as part of the tympanic nerve. The tympanic nerve, which also carries sensory fibers, enters the tympanic cavity through the inferior tympanic canaliculus and branches out across the promontory to form the tympanic plexus. The preganglionic parasympathetic neurons emerge from this plexus and form the lesser petrosal nerve, which exits the tympanic cavity through the superior tympanic canaliculus to enter the middle cranial fossa. It travels anteriorly, deep to the dura mater, through the groove for the lesser petrosal nerve, and descends through the foramino with the mandibular division of the trigeminal nerve to reach the infratemporal fossa. The preganglionic parasympathetic neurons of the lesser petrosal nerve synapse at the otic ganglion. Most of the postganglionic parasympathetic fibers that leave the otic ganglion join the auriculotemporal nerve. The auriculotemporal nerve takes the parasympathetic nerves into the retromandibular fossa, where they provide secretomotor innervation to the parotid gland. The parotid gland is dealt with in greater detail in the Solid Anatomy lecture on the oral cavity and oropharynx. One of the terminal branches of the external carotid artery, the maxillary artery, passes deep to the ramus of the mandible to enter the infratemporal fossa. The artery may travel superficial to, deep to, or through the lateral pterygoid muscle as it proceeds medially. A remarkable number of branches are given off by the maxillary artery, including arteries that supply all of the muscles of mastication and parts of the external and middle ear. The inferior alveolar branch follows the nerve of the same name into the mandibular canal and supplies the mandible and its teeth, while a superior alveolar branch supplies the maxillary teeth. A particularly important branch, the middle meningeal artery, passes superiorly between the rami of the auriculotemporal nerve and traverses the foramen spinosum to reach the middle cranial fossa. The artery branches extensively between the bone and the dura mater and supplies both. Trauma to the side of the head, especially at the level of the pterion, may damage this artery and cause an epidural hematoma. The maxillary artery continues medially into the pterygopalatine fossa.
All right, it's time for a clinical correlation. Now, before we move on to the pterygopalatine fossa, I want to draw your attention to a clinically important concept with one of the branches of the maxillary artery, and we're talking about the middle meningeal artery. Now, after branching from the maxillary artery, the middle meningeal artery branches into an anterior and a posterior branch. Now, the anterior branch of the artery can become particularly vulnerable at the point where it crosses the pterion. So what's the pterion? Well, the pterion is the area where the sphenoid, the parietal, and temporal and frontal bones all come together, and they form this H shape. So if trauma occurs to the area, like a blow from a baseball bat, and that's where you're going to see this scenario where either somebody gets hit with a baseball bat or with a baseball, they immediately lose consciousness, they will regain consciousness, and then an hour or two later, they will deteriorate and lose consciousness again. So that's the typical scenario when you see this happen. So that artery can rupture at that point, and it causes what we call an epidural hematoma. And that can be very, very serious and even deadly. And remember that the artery branches between the bone and the dura mater, and that's why it's so likely to rupture this artery in that area. All right, so that's enough for me. Let's go over some of these questions. First question here, what artery is often damaged with trauma to the pterion? Well, we just talked about it, so you better know it. Middle meningeal artery, or more specifically, the anterior. Sometimes it'll even be referred to as the frontal branch of the middle meningeal artery. Next question. What type of hematoma does a rupture of the middle meningeal artery cause? Remember, that's an epidural hematoma. And remember that you're going to have that situation where you get hit in the head, you get knocked out, you get back up, you feel okay, and then an hour or two later you decompensate, and then you lose consciousness again. All right, guys, let's get back to that lecture now.
The pterygopalatine fossa is a small but well-trafficked pyramidal space located medial to the infratemporal fossa. The infratemporal and pterygopalatine fossae are continuous with each other through the pterygomaxillary fissure, which may be considered the lateral border of the pterygopalatine fossa. The remaining borders of the pterygopalatine fossa are the pterygoid process of the sphenoid posteriorly, the posterior aspect of the maxilla anteriorly, and the perpendicular plate of the palatine bone medially. The superior border of the perpendicular plate of the palatine bone has a sphenopalatine notch, or incisure, that becomes the sphenopalatine foramen when the sphenoid bone is in place superior to it. The sphenopalatine foramen allows the pterygopalatine fossa and the nasal cavity to communicate with each other. The inferior orbital fissure in the anterior wall of the pterygopalatine fossa opens into the orbit. The foramen rotundum, which leads to the middle cranial fossa, and the pterygoid canal, which also leads to the middle cranial fossa via the foramen lacerum, are openings in the posterior wall of the pterygopalatine fossa. While the mandibular division of the trigeminal nerve is the principal nerve of the infratemporal fossa, the maxillary division is the principal nerve of the pterygopalatine fossa. The maxillary division, which is entirely sensory, extends from the trigeminal ganglion in the middle cranial fossa, where it gives off a meningeal branch, and runs anteriorly in the dura mater that makes up the lateral wall of the cavernous sinus. Next, the maxillary division passes through the foramen rotundum and runs across the superior aspect of the pterygopalatine fossa, where it gives off the zygomatic nerve, which follows it into the orbit through the inferior orbital fissure. It then travels in the infraorbital groove in the floor of the orbit as the infraorbital nerve, while the zygomatic nerve splits into branches that pass through the zygomatic bone to innervate skin on the cheek. As you may recall from other solid anatomy lectures, the infraorbital nerve gives off alveolar branches to the maxillary teeth before emerging onto the face to innervate skin from the lower eyelid to the upper lip. Within the pterygopalatine fossa, the maxillary division of the trigeminal nerve suspends the pterygopalatine ganglion, a parasympathetic ganglion of the facial nerve, by two ganglionic branches, which represent the sensory root of the pterygopalatine ganglion. These ganglionic branches do not synapse in the ganglion, but they divide into several sensory branches that emerge from the ganglion to supply mucosa in the nasal cavity, the palate, and the pharynx. Some of these nerves will be described in greater detail in the solid anatomy lectures on the nasal cavity and nasopharynx, and the oral cavity and oropharynx. The motor root and sympathetic root of the pterygopalatine ganglion are the greater petrosal nerve and the deep petrosal nerve, respectively. The greater petrosal nerve is a branch of the facial nerve made up of preganglionic parasympathetic neurons whose cell bodies are in the superior salivatory nucleus in the pons. Although it does not synapse there, the greater petrosal nerve leaves the facial nerve at the geniculate ganglion and passes through the hiatus of the facial canal to enter the cranial cavity. It runs under the dura mater anteriorly through the middle cranial fossa in the groove for the greater petrosal nerve. This groove is medial to and runs in parallel with the groove for the lesser petrosal nerve. The greater petrosal nerve then drops into the foramen lacerum. The deep petrosal nerve, which carries postganglionic sympathetic nerves that synapsed in the superior cervical ganglion, travels in the nerve plexus surrounding the internal carotid artery. The internal carotid travels in the foramen lacerum for part of its course, and it is here that the deep petrosal nerve leaves the plexus and combines with the greater petrosal nerve to form the nerve of the pterygoid canal, which enters the posterior end of the pterygoid canal near the base of the pterygoid process of the sphenoid bone. It's able to do that because the sphenoid bone forms the anterior wall of the foramen lacerum. The nerve of the pterygoid canal enters the pterygopalatine fossa through the anterior end of the pterygoid canal and joins the pterygopalatine ganglion. The parasympathetic neurons in the greater petrosal nerve synapse at this ganglion. Postganglionic parasympathetics follow the sensory branches that leave the ganglion to the nasal, oral, and pharyngeal mucosa, where they provide secretomotor innervation to mucus glands in these areas. Some of the postganglionic parasympathetic fibers follow the zygomatic branch of the maxillary division into the orbit, then travel along a communicating branch to reach the lacrimal nerve, which brings them to the lacrimal gland, to which they provide secretomotor innervation. The postganglionic sympathetic neurons in the deep petrosal nerve do not synapse in the pterygopalatine ganglion, but they follow the sensory branches leaving the ganglion to the mucus glands, where they are thought to provide vasoconstrictive innervation. When the maxillary artery passes through the pterygomaxillary fissure, it gives off branches that follow most of the nerves in the pterygopalatine fossa. Most of the arteries in the infratemporal and pterygopalatine fossae have a corresponding vein draining the area that they supply and emptying into the pterygoid plexus of veins that surrounds the maxillary artery in the infratemporal fossa. The pterygoid plexus connects to the cavernous sinus via so-called emissary veins that pass through the foramen ovale, and is also connected to the facial veins superficially, which are important considerations with regard to the spread of infection. The pterygoid plexus drains into the maxillary vein, which merges with the superficial temporal vein to form the retromandibular vein.
So that covers the lecture on the deep face part 2. Now I want you to pause the video and answer the end of session quiz questions, and then we'll go through those answers together. All right guys, let's get going. First question here. What are the sensory branches of the mandibular divisions of the trigeminal nerve? Remember, Malibu is a good mnemonic that you can use. So we have a meningeal, auriculotemporal, lingual, inferior alveolar, and the buccal or the long buccal. Next, what foramen does the meningeal branch of the mandibular division of the trigeminal nerve pass through to enter the cranial cavity? So this could be the foramen spinosum or the foramen ovale. Next, what cranial nerve provides motor innervation to the buccinator muscle? So you might be tempted to pick the buccal nerve, but this would be incorrect. The buccal nerve provides sensory innervation. For motor innervation here, it's actually the facial nerve. So that's going to provide your motor innervation to that buccinator muscle, and it's the muscle of facial expression. Next, what foramen does the maxillary division of the trigeminal nerve pass through before running through the superior aspect of the pterygopalatine fossa? That's a mouthful there. And the answer is the foramen rotundum. Next question. What nerve innervates the skin over the cheek? And that's going to be the infraorbital nerve. All right, guys, we're almost done. So again, we provided some images for you to label. Now remember also that recalling these images in a time setting will help you to perform well on the practical part of your examination. So label the images and then we'll be finished. Thanks.